called this as you can see here, Tri-County CoC Coordinated Assessment Demo. So this is not the final coordinated assessment, of course. We can still workshop this, but I wanted to give everyone who might be able to have touch on this form an opportunity to really just look at how it functions for them and how it might work for us as a system. And so we're going to try that today. So for everybody who's at a station and is looking at their browser, please make sure you're at njhmis.footholdtechnology.com and you can log into your profile. And once you're inside your profile, what we're going to do is we're going to go right to the form. And I made a couple fake people last night in our training program, and so we'll do the form on them. And, you know, I think Josetta and Bob, you guys can take one each of the people that I created, and then we can maybe create some fake people together if you want, so that we can look at it and see what the impact is of different types of demographic information of a client or a household on whether or not they score highly on our form. All right, so the form is located in the one. Dawn, are you there? I believe that I successfully unmuted you, Dawn. So please feel free to holla at me, yo. All right? All right, so otherwise there's question boxes for everybody else. Okay, so when we're in here in the form, you can select your consumer. I'm going to select a random consumer that someone else had created called consent form. Very pretty name, okay? And everybody else, just make sure you don't select TC1, TC2. Okay, good, got it. And, you know, just pick somebody else on the list. Some of them may have incomplete information because this is just a training program, so we'll navigate that together. But then I can click Continue if I'm going to go to the prioritization form. You can see that now, if I had already done a prioritization form, it would be here. It would be listed with the date that it was entered. But right now, I don't have one completed for consent form. So I can create a new Tri-County CoC prioritization tool for consent form. In your cases, it'll be someone else's name that you can see here. So once I click that, it'll take me to the form. Okay, so you can see that now there is a full view of the form, and right now it's read-only. I can't actually edit this. This would just be if you wanted to quick glance at whatever tool you had already completed. In order to edit this and create a new tool, what you have to do is scroll all the way to the bottom, and you can see update. Okay, so that's create is updating something from a baseline of no information, and if you had already completed the tool, let's say their income changed, you could update it here, and if that would change their prioritization score or something of the sort. Okay, so you can click Update Tri-County CoC Prioritization Tool, and now I'm going to enter in the date that I conducted this tool, and today is March the 29th. The household's current living situation. This program is called Emergency Shelter Training Program. So I'm going to assume that they're in an emergency shelter training program, so they're in an emergency shelter. The number of days the household is in their current location, so you can see that's pre-populated based on what their intake date was. I'm just going to check up on questions to make sure everybody's on board with me. Okay, we good. We good. Okay, Bruceville. All right, so continuing on, you can see that there's a question asking about the number of days. So based on that, what range are they in terms of the length of homelessness? We are prioritizing based on who's experienced homelessness for the longest period of time. That's one of our criteria. So because it's 148 days, it's less than 365, I'm going to select 91 to 365. You all can select what's appropriate for the consumer that you're looking at. Please also shout out if you guys are missing information for one of your consumers. It'll happen later, I think, with one of yours. Prior living situation, okay, place not meant for human habitation for consent form. So that means that I would select this answer, place not meant for human habitation. It's already pre-populated for me from the intake that I had conducted with them. Okay. Approximate date homelessness started. That should be pre-populated in there from your intake, and then you can see that we're answering, is that date more than 12 months ago? Okay, so this person, consent form was 11/1/2016, so it hasn't been 12 months, back to, March 29th of last year. Go ahead, Domenica.
With the days that you had listed, was that 148 or 1-248?
Yes, it was 148.
Okay. If you go down to when the homelessness occurred,
yes,
as you scroll down, if that does not coincide with that, is it going to come up with an error?
No.
Okay.
So here's why. Because it's two separate questions.
Okay.
Okay, good question though. So if you folks have done HIMIS intakes, you know that the number, or you can figure out that the number of days the household has been in their current location would be their entry date, their program admission and start date, right? So let's say it's hotel-motel placement. That means that 148 days ago, we placed them in a hotel. Okay. However, let's say that that person came from a place not meant for human habitation. That means that technically, since those are both homeless locations, they could have been homeless before they got into the hotel. So their length of time homelessness, it could be more than 148 days,
Gotcha.
right, based on that. They're two separate questions. So we're not just saying, okay, because you've been in emergency shelter for 100 days, you're the most prioritized person. If there's someone who's been in a shelter for 90 days, but they were homeless for a year on the street prior, they're going to be more highly prioritized. Okay. So I'm going to answer this question as no, because it's not been 12 months or more. And then for the next question, regardless of where they stayed, the number of times they've been on the street in the last 3 years. So this goes to episodic homelessness. This person consent form says 4 or more times, so they've actually had multiple episodes of homelessness in the past couple of years. So I'm going to select 4 or more times based on what it's pulling in from their intake sheet. Okay, and then the total number of months that the client has been homeless on the street. This means that they've been homeless 4 or more times, but only for a total of 4 months in the past 3 years. So I'm going to answer 4, the total number of months they've been homeless. Okay, and then does any household member have a disabling condition that's expected to be of long-term duration and substantially impairs ability to live independently? This is the only piece of information for this assessment that wouldn't pull in, right? Because like I had said in our first meeting on coordinated assessment, I would have to pull in about 9 separate fields in between that question 6 and question 7 because it has to do disability separate. If you remember on your face sheet or your intake form, right, we can go through that when we create a fake person. But you'll know you have to answer yes, no to every single disabling condition. So just to make it less cumbersome, we're assuming that you're doing this assessment deliberately and that there's some knowledge of the client's case. If we want to amend this form and have stuff pull in, we can talk about doing that. I just didn't do it as of now for our demo here. Okay, so I'm going to say that I know consent form, and yes, consent form has a disabling condition that impairs their ability to live independently. Then the next question is, does any household member have both a substance abuse disorder and a disabling mental health condition? And the answer is going to be no. Don't have co-occurring, and they don't also have trimorbidity or 3 disabling conditions, including mental and substance abuse disorders, mental health and substance abuse disorders. And then, does the household meet the definition of chronically homeless? So I'm going to update this form with this question because I found a neat little trick when I went to an HMFA presentation the other day. You can actually pre-populate this to calculate based on HMIS data. So let me tell you what that would look like. So right now, if I'm determining whether this person is chronically homeless, I have to know the definition myself, right? So let's go back. What does the definition of chronic homelessness have to do with? Length of time homelessness and disabling condition. That's it, okay? So, and where they currently are. So we know they're not in transitional housing or permanent housing. They're in a homeless location right now, okay? And they had 4 or more times where they were homeless in the last 3 years, but those episodes only add up to 4 months. So that means they don't meet the episodic definition of homelessness because you would have to have 4 episodes with a total of 12 months, okay? But, so let's see, how long have they been in homelessness right now? It hasn't lasted 12 months or more. So that means that even though consent form has a disabling condition and is in a homeless location, that they do not meet the definition of chronic homelessness because they haven't been homeless for 12 months or more, and they don't have 4 or more episodes that equal 12 months or more in the past 3 years. Okay, so I can come back here. Again, hopefully this is a real person that you're not just hypothetically looking at their HIMSS record, and you can know what their situation or their homeless or housing crisis history is a little bit before you conduct this, okay? But, my goal is to include another pre-populated piece of data here that will be a yes or no based on whether HIMSS sees them as chronically homeless or not. Because if they've been in, Bob's shelter for 12 months, which I know Bob would never let happen because he would rapidly rehouse them, but if they stayed in shelter for 12 plus months and they have a disabling condition, automatically the HIMSS system would know this person's chronically homeless because they've been in a homeless location 12 months or more with a disabling condition. Okay. All right, so we know that consent form is not chronically homeless. Okay. Monthly income sources, this would pre-populate. I think you guys will have pre-populated information with your clients in terms of monthly income sources. That's blank for consent form. So unless I know, as their caseworker, I would say that no, they don't receive information or income from any of the following sources based on the information I have, because it doesn't even say no source of income. I could take this blank field to mean no source of income, but then it would populate as no source of income because that's one of the options in the face sheet. So I'm going to say that I don't have enough information to really do this criteria right now. So I'm going to say no, that I can't be sure that they receive any one of these sources of income, including no source of income. Okay. Monthly income amount, that is answered, and that says none. So maybe I'm going to change my answer to yes, okay, because I see, oh, none. That means no source of income. So let's just go with that. Again, this is a record somebody else created in the training program, so You know, I just started working with consent form today. Okay, I didn't know her before. Consent sounds like a female name, right? I don't know. I forget. Anyway, is the total monthly household income less than $800 based on the above? If the answer is that they have none, no source of income, I'm going to say yes. Okay. Has any member of the household been a victim or survivor of domestic violence in the past 6 months? And let's see, based on what I know of consent form, I'm going to say that no, they have not been a victim of domestic violence in the past 6 months. How many times has an incident with the police or a visit to the emergency room or an inpatient psychiatric hospital visit happened in the past year? I'm going to have to be asking those questions separately in order to complete this form, because those are the only questions that are non-HIMSS questions for this assessment, okay? So let's say that, yes, this person has had an incident with the police once in the past year. They were arrested, and once went to the emergency room, and 0 times was at an inpatient psychiatric hospital. I didn't just guess this. Of course, I interviewed consent. Right? Okay. And then I can hit save once I've gone through the whole form. I'm just going to check for questions before I move on for all our folks in cyberspace. Okay, it seems like everybody's on the same page, or at least around here with us. Okay. Any questions for you guys? What?
Oh, no, me and Bob have to start work.
Okay, cool. All right, so once I hit save, I'm going to create this prioritization score for consent forms, so you guys can do it with the clients that you have, okay? And then what I'll see down at the bottom here is all of a sudden I have a household prioritization score based on the criteria that we've determined and that paper handout that we sent out last time. So I'm interested, Josetta, what did TCO2 get?
36.
36, right? That's a chronically homeless guy out there, TCO2. And then TCO1, Bob, what did they score?
Actually, I picked Bob Smith.
Oh, how did Bob Smith do?
Bob Smith did 24.
24. Okay, so based on this right now, in terms of the forms that we did in this room, I don't know about the folks in cyberspace, but in terms of the folks that we did this prioritization tool on, consent form is at the bottom of the prioritization score list, right? And so let me show you how that's going to work. And I think I did this last time, but just so you guys are aware of exactly what the, you know, hard and fast reason is for this being important, okay? I'm going to just go into my profile because I have access to the form builder, which is going to let me actually utilize this data, and I have no idea how to escape this. But
Should be an X at the top.
yeah, but Foothold is pigeonholing me in, and I actually have to shrink this saving. Otherwise, I didn't have the close button anywhere.
Huh.
All right, so now I have to go to Form Builder, which is where we created the form. Okay, and then I'm going to do a Form Builder Report Builder. I'm going to do it for training, emergency shelter. I'm going to do it for, let's do it for the beginning of the year to now, and we're going to do it for the Tri-County CoC Prioritization Tool, and we're going to continue. I'm going to just do client ID, first name, or last first, and then household ID, and then I'm going to do prioritization score. Okay, and then now, what is this stuff down here? Come on, Foothold.
Welcome to our world, right?
Well, it's just a pop-up in the window. Yes, no, trust me, Domenica, I understand. Okay, and then I'm going to show individual detail, and I'm waiting for the voila moment, okay? I want to say voila.
And this is going to show everybody through our Tri-County CoC or on the entire program, or just through our agency?
What in the unholy crimson heck happened here?
Wowie. Cool.
This is terrifying. All right. I don't like this computer, I've decided. Okay. I'll just create it as big as I can over here. I don't know what happens to do this. Does anybody know what the heck this is? Okay, Magnifier. Oh, there we go. Sweet, Mahalia, who knew? Okay. All right, so you can see that what we've successfully done is we created a prioritization list. just like that in 5 minutes, right? So what we'll...
But only within our particular input. It's not going to show you everybody.
Right, so what you can see here is I've run the report for Training Emergency Shelter, which is just that program that we were entering information in because there's no ramifications, right? And because right now that prioritization tool is only available to training programs. Once we go live, we would make sure that we know every single program that's going to need to complete this prioritization tool, whether it be a Board of Social Services SHUSH program, so it could be in their services module, whether it be a shelter program. We have to figure out how we're going to get information from maybe outreach providers and get that information into HMIS, or be it a separate spreadsheet. But what we can do is I will have the capacity, and we as the CoC will be able to see. You can see here, I'll go back to the very beginning of the menu. Check this action out, right? I could change my criteria of what program I'm running a report for to something like this. Boom. All Warren, Sussex, and Hunterdon homeless-only programs. So all of a sudden, I run one report, and we have everybody's prioritization scores regardless of what program they're in our Tri-County CoC. Because when the program is set up, you set it up to be within NJ 516. Everybody has done that when you work with HMFA to set up your HMIS program. So we would be able to sort by that. I could select a date range for active clients, and then we could do the same thing that I just did and continue and structure that report so it includes the prioritization score. Then I just, we can export that spreadsheet, sort it by score, or I can even sort it by score in HMIS. All right, let's just try that. And now that I remember, of course, I'm not going to be able to do it because it's not in this Tri-County CoC program. So I'm going to go back to training. Okay. Okay, I'm going to do it again for search. Continue. First. Okay. Okay. Can I sort here?
Can everyone run reports or just admin?
So here's the trick. Okay, this is the only trick in terms of the actual administration of this system, is that HMFA does not give each individual agency form builder right access. So we need to figure out with Candy and Vanessa how and who is going to administer this. As of now, in order to access the form builder module, there's training that has to take place. So I had to go through a whole training to get access to it, to understand how to utilize it. We have to talk with Candy and Vanessa about who and whether that's an option for other users. That's still something we need to navigate. Okay. But so basically what we would do is, again, let me just run it again. I think the way that we would do it is sort by household, sort by total score. And then we'll go A to Z. Let's go Z to A. And that should do it. Should be the highest to the lowest. Training emergency shelter. Oh.
Yeah, didn't do total score.
Yeah. No, that's because
From Burlington.
It's going to be Burlington.
Josetta, you nailed it. I ran it for the wrong prioritization tool. I'm like, this does not look like the right set of options. See, that was the default. I got to change it. So.
But it does make sure
you can
pay
see that.
attention
Yeah,
to what you're looking
exactly, exactly. So I could still do it from here. First name, last. There we go. See, now it all makes sense again. My world is at peace. Okay. Total score is way less cool than household prioritization score, right? I mean, come on. What are they thinking? Okay. Visual detail, sort by household prioritization scores, E to A, boom. And that should do it. Yep, so it's sorted by that. Okay, so I'm just going to go down to our questions and see if anybody has any questions. I'm wondering, folks in the room, I mean, any questions, concerns, feedback, just off the bat here?
Did we sort out what, as far as how we doing the DV? I mean, because DaySec does not enter in.
Correct.
And if we're working with the same individual, how is we doing this?
Well, so that's a good point. So that's something we need to figure out, right? That's why we want to have this other, I have suggested that we have a coordinated assessment meeting where I'm not saying anything. I just give you guys talking points to figure stuff out with everybody, because like my projected suggestion would be really not difficult to ask DSAC for de-identified anonymous information with identifiers only they know, and then have them complete this tool. In order for, as Bob knows, right, if you're a sponsor agency for this for a CoC funded program, you have to be able to do HIMSS APRs. And so DSAC is required to collect this information for their clients regardless of whether or not, you know, they're actually in HIMSS. You have to have a comparable database. So they have to have all this information for at least those clients that they're going to put in CoC funded projects, so they know how to do it. To me, it's not that big a stretch to ask 3 more questions and have them provide that information, including the scores, right? We had provided the paper form the last time. It's just like, okay, if yes, then 2. If no, then 5. If those types of things. And then we can integrate that spreadsheet into this spreadsheet. I can export this, right, Excel file, and download it, and I can save it, and then I can just add in what other records I have. Let's say that path providers can't all figure out, or some of them figure out and some of them don't figure out how to do this or are willing to do this in HMIS. Let's say that there are programs from Board of Social Services, like EA programs, that aren't entering into HMIS right now, right, for some of our counties. We have to figure out how to get all that information in. Not, you know, there's hotel motel people out there that we don't have in HIMSS in our Tri-County region. So how are we getting their information so they can be prioritized, right? It's something we all have to grapple with all around. Go ahead, Maria.
Also, do you have anywhere in the form that a lot of PCP, primary care physicians?
Nope, not now. Not right now, we don't. But this was something that was brought up at the, that Michelle brought up.
Right.
So, I mean, like I said, this form is still demo. It's still here for us to determine. The thing is that we have to determine whether asking about whether that person has a primary care physician or not is a question that we need to ask prior to them being prioritized for housing, right? So the purpose of this tool is just for prioritizing for housing. So maybe that's a tool or a question that we're asking in some other way once we're providing services or case management or something, to make sure that they have access to services that are necessary to be stable and healthy in their housing. But what we've tried to do with this form, as you can see, I'm just going to log out and then go back here. I think that's probably log out. I can't with this different sizing. You know, we can look at the form, and the point of the form was, let's try to figure out what we can do and have the least possible extra work, you know, for someone who's doing HMIS input. Because
but it's just that you, one of the questions was how many times has the member been at the emergency room?
right.
So I figured if you mentioned emergency room,
Right.
was your...
Right. So, you know, the reason that question was asked specifically is because those last 3 questions are literally the questions that HUD suggested would be proxy measurements for vulnerability, right? So I'm not saying that having a primary care physician wouldn't be another good proxy. We just have to determine what we want to prioritize in terms of the information we were going to get. So once again, all of this information is already collected in HMIS up until these last 3 questions.
But also, I think, I understand your priority in terms of the personal care physician, but a number of our clients are not going to the ER because they're actually sick. They're going to the ER because they're actually homeless, and they need one place to crash for 24 hours till somebody figures out they're not sick, and they get in touch with us.
And you know what the thing is we can also workshop the phraseology of these questions, because I've already had that conversation with folks from Sussex who are out there in cyberspace right now, but the issue was at the time, and it has since changed, that, for instance, this question about being and having an incident with police, being incarcerated or arrested, up until last year, the police were your primary way to get a hotel motel placement after hours in Sussex County.
Yeah, they just call it.
Right? So what does that mean? Right? Are we counting that? Is that an incident? Well, we have to, if we need to clarify the question, we just clarify the question. That's not a problem. We just have to figure out what we want to say, how we want to ask it. If we want to say, get rid of this incident language and just say, been incarcerated or arrested, or something like that, that's fine. It does not matter how we're getting the information as long as it's accurate.
What's the purpose of that question? Because of the difficulty of getting housed, if you have record, or what's the end product of that question?
It's twofold. One is definitely what you just said. It's a barrier to housing to have a criminal background or police record. But secondly, it's also about vulnerability, right? So if you're engaged in criminal activities, or you have maybe it's you've been arrested for public drunkenness and substance abuse, or whatever it is, that's more of an indicator of your vulnerability in that domain of public safety and public health. But we can also choose other measurements. These are just the 3 measurements that HUD suggested that we know meet the litmus test of the folks that are looking down our neck about whether we're doing coordinated assessment or not. So, and looking down our neck sounded wrong, so over our shoulder, okay? So any of these questions could be workshopped and changed, but the goal was, let's make it as bare bones as possible and meet our standard, so that our folks who are doing the HMIS data entry don't have to do more than they're required to. But as you can see, I mean, really at the end of the day, if you've already done intake with someone and they've been in there for 30 days, you have 3 questions you have to ask them, and the rest is already there for you to complete. And it spits out a score that you can then reference and understand. And you can also, we can figure out policies around, okay, if the household is within this range, this is what we're going to make sure we have a conversation with them about. For instance, consent form was a 19, right? And then TC01 and Bob were 24 and 36 or 39, 36, right? Consent form's not top of the list. So what am I telling her? Am I saying, consent form, sorry, just so you know, you're out of luck. You better, take a bus to Morristown. Or am I saying, just so you know, you're not at the top of the prioritization list. We don't have a great deal of turnover, so is there anything let's figure out how we can work on getting you, directed to housing without relying on a permanent supportive housing voucher, even though you have a disabling condition. Is there anything else we can leverage, any other resource we can turn to? What are our options? Because we know the number of turnover beds we have each year, right? In the CoC, we have a very limited number of vouchers, right? There's not going to be a lot of people placed in permanent supportive housing in this community, period. Unless we are continuing to beat down the doors of other housing providers, landlords, probably public housing authorities, and those types of resources, or we get a large influx of vouchers somehow. We have this moving on program, right? So right now, if we strike while the iron is hot and we start doing assessments with folks, we can place 16
right now.
16 homeless people into permanent supportive housing, right? A number of them will be, needing to be families and need to fit some program specifications, but that's a lot of people compared to what we were able to house last year in permanent supportive housing, right? So those are the reasons that we're hoping that this is the way we can start operating. I'm just going to double check on our questions if I can. Yes. All right, so not seeing any other questions, do we want to create, like workshop an actual person that you guys might experience coming in? Are you interested to see what the impact would be on scoring? If you want, you can just think off the top of your head and I'll do an intake for everybody on screen. It's up to you. I don't know if that's something that you're interested in.
What, honey? You want me to make somebody up?
Yeah,
All right.
I think that would be good.
I do have a question in terms of the form.
Sure.
All right. When you hit update and it comes up with the prioritization form, can we put that at the top of the page rather than the bottom so that I don't have to scroll all the way down, check it?
Oh, we could do that. I could have it pre-populate at the top and the bottom.
Yeah, because it'll save a few seconds, but it'll save a few seconds.
Yeah, sure. That's great. That's great feedback. I can definitely do that.
I did not know where that was.
That's what I'm saying. So if we can get it at the top of the page, you don't have to look anyplace.
All right. So let's do a fake intake.
Okay.
If that's what you would, if you think it's going to be useful here. Training emergency shelter program. Okay. Create new application. Domenica, you want to rock the Casbah?
Thank you for having me.
You want me to type? You don't know how slow I am.
Domenica, I trust you. I trust you.
Yeah, you're expecting that I'm going to coordinate from here to there.
All right, so Domenica is doing our intake today.
Domenica's can't see squat.
Well,
So we're looking at shelter bed.
sure. So these are your vacant units that you can place
Okay.
someone in.
So do we want to use this in terms of, if we've got somebody who's homeless, I'm not placing him in a shelter bed, correct?
So this is an emergency shelter program. So
Right.
yes, we're saying that we're going to intake this person into our emergency shelter
Gotcha.
program. So place them into one of the non-occupied units. There you go.
Okay. So this is and we don't want
Just
burden.
leave that. Once
Okay.
you keep going, that should go away.
So
Doesn't matter.
who we pick for primary worker, doesn't matter?
Nope.
All right, so I'm going to do, where the heck that is. All right, to be determined by referral, first name, and this is the person's name?
Yep.
Right. I can't, I'm sorry, honey.
Let me make it big. Let me make it a little bigger for you.
That would be just lovely. Actually, what I could just do is get up and walk over, but, oh my, that'll do it. All right, social security number. Do you care?
No, make it 9s or 0s or 27s.
27. How's that? Make you happy?
UDA. Just say it's full. Fine.
Gender. Well, he used to be male.
There you go.
1970. How's that? Quality, ethnicity, he's non-Hispanic, Labrador Retriever. He is white, at least he was. Veteran status now. Type of residence. All right, place not meant for habitation. That should get him a good score. Length of stay.
And see, you just hit upon one thing to consider.
Yeah.
We won't want to just create someone who necessarily is going to score high, just right. So this is the
You want me to do
flexibility.
something 2 to 6 nights and just
Do
be?
something that you think is realistic, that you would actually encounter someone that's being
Probably
placed
1
in
week or more. Approximate date homelessness started. Holy moly.
So that would be how long they've been either on the street or in emergency shelter most
Well,
recently.
if we're doing length of stay 1 week or more, let's say 03, 15,
Yep.
2017.
Great.
All right, regardless of where they stayed last night, number of times clients been on the streets in the past 3 years, so we're gonna say 3 times. And total number of
Months of those episodes.
so let's say 4 months together. Chronically homeless, no. Income from any source, no. They're self-employed as a hooker.
No income, okay.
Non-cash, no. Covered by health insurance, no.
The house foreclosed on, so he had to leave the property.
Physical disability,
No
yes.
psychiatric assessment.
Now, question about this long-term. We had a question about the semantics of substantially impairs their ability to live independently. I always have a question about that because in all honesty, if they can't live independently, what are they doing living homeless? And how would we then place them?
Well, that's what the supportive services that wrap around a voucher would
So I'm going to say yes.
be helpful.
We don't have documentation and they're not currently receiving. All right, developmental disability, yes.
It's like identity.
No,
They did.
no. Chronic health condition, no. HOA AIDS, no. Health problem, yes. Yes. No. What's up? Nope, managed to stay clean. Oops.
Well, he did say that, but now he's not saying that. He did say that.
Okay, so they're listed as a disabling condition. Information dated today. They're not as victims of domestic violence. Okay, now we are not required to answer these questions. Individual family type, individual male. Homeless cause. We're gonna say release from prison, jail. Zip code. No.
It would curse me out.
Shelter housing would be then.
Sure.
Okay. All right, and then,
Housing admission.
okay.
If I'm referring to family government, I don't even think it was.
All right, close it.
You see why we like it sometimes, Jay?
And of course,
This is not my profile, it's the guest profile, so it might have like very. Right.
Oh, no, you didn't even update them, so everything's blinking.
Yeah.
I could cry, but that wouldn't do anybody any good.
no, and we've all been there.
So based on a complete social history, there's no psychiatric or no alcoholism.
Yeah, there's alcohol in the past.
You gotta go back to taking admission, huh? Holy moly.
Well, let's just see if it works.
Nope, he's been good. Not even Sunday. Yeah.
I
Nope,
don't
no
see
Sammy.
Sammy.
All right, well,
Let Courtney was supposed to do the next one.
that's
You
a
know,
rough
I'm
one.
good.
I'm so sorry.
Why?
Well, I mean, that was a bummer, eh?
Yeah,
It's not my fault, but I'm sorry in empathy.
that's okay. I'm gonna shift it over to the next person.
Okay.
I know what we need to do.
Well, you got kind of.
Why are we doing this? I understand how to use this program. I do. Then why are we doing this? Actually, I did love the training when we did the initial minute. That was great. Raymond?
What do you want?
Oh, wait, so that's-
That I know who stayed, his daughter named a shed.
Put them in. You can use your profile.
You wanna use
And
somebody?
training services.
She wants to do Raymond.
Blue box.
Okay.
Blue.
I mean, the only reason I suggested this is if it's useful to you to
Oh,
see
Mr.
what the
Work.
impact is, right?
No.
We
Oh.
already did
Oh.
this last year, right? Gisetta, you and your staff already did some of this last year with this same tool. You already did some.
But this one right here, the one that I did last year, he wasn't involved, but I just got him, he just came in for services back in November.
Mhm.
But he literally was living in his shed for the past 5 years.
Right.
And the only reason why he
needed
came
one.
in is because that
Why?
house was
Oh,
foreclosed
no,
on. He
I don't
had
need
to
one.
leave from the property. But he had a generator, he would go to the river and get water, like
Yep.
he lived outside. So, but he don't have enough, like, those 3 questions,
What do you want to do?
he would be, he wouldn't even get the priority
now.
point.
But he would for length of homelessness, he would
That's
for,
good.
well, if he has, does he have a disabling
How
condition?
long was
If he
he?
has no disabling condition, then there's no way to get him into permanent supportive housing anyway. You have to have a disabling condition.
December.
So he might be someone that would be really highly prioritized in terms of rapid rehousing.
We're gonna see what comes out of this.
How long has he been in the shed? 5 years?
5 years. So,
2012.
yeah. Yeah, 'cause that's when you lost yourself.
Number of times, so what,
One time,
one time?
Yeah, it just happened to go
Number
on
of-
for 5 years.
more than 12
months.
months. Chronically homeless, no disabling condition, so no.
No income?
Yeah,
Is GA,
yeah,
Okay.
140.
where's GA, other? No, it's
GA run out.
You have to scroll over to the right.
Unless he's safe and he doesn't have a disability determination, but he's deemed unemployable.
Yeah, yeah, Medicaid.
he's got nothing, right?
No, nothing, nada. And yeah, alcohol and gas, not currently, that was higher.
So what did we say he has a substance abuse?
To his history?
Oh. Yeah, so you say yeah, but he's not.
So we'd say no.
There you go.
You don't want to do documentation, or you want documentation?
Well, we have documentation that we have it.
Because he did go, he was referred to FAI, and that was
Forever ago?
Oh, I keep doing.
Yep.
Son of a bitch, wait, I say I put. Did I put 16 or 17 when I did this?
Lost a job?
Well,
Eviction?
no, he never had a place.
Foreclosure, owned property.
He didn't own it.
But did he rent a place at one time?
No,
Did he have a job at
he
one
was in
time?
a truck. He was driving truck.
All right.
Okay.
So,
But he lost his job.
Unknown.
Unknown.
Let's
And
do
that
it.
one, I couldn't even say.
I'm just putting,
07, 83.
Yeah,
we're so keyword.
we aren't bored enough to say not
I don't
home.
think he did, I never even referred to him.
Not yet. Single.
Are you sure this is the correct spelling?
Yeah.
Okay.
And so that's your disclosure.
No, he's not a man, his dog. No, he don't want me to do his dog. He'd be like, I ain't
All right, then you want to
Alright.
go back to home?
We wanted
Go
to, oh wait, where's home here?
Yep.
Right there.
Student charts, student services.
This one, right?
Yep.
There he is.
Oh, he's down there.
Now that's something I can't save you time on. The button automatically goes to the bottom.
Okay. Listen, it took me forever to get Abram to do all that stuff on the side, and then we changed everything, and it's gone anyway.
Mhm.
Kind of so common.
We said one.
And why doesn't that populate from
It
the
does.
previous?
It's there. You just have to still answer a question on it.
Okay.
So the way that this form builder works is I can create scoring outcomes, but only for questions that I generate, not for read-only fields.
Gotcha.
No.
How do we,
No,
Does he have GA?
no,
It says income, oh, no.
no, it doesn't mean the following.
Sources.
It says national. It'll be, no. Nope.
Why are those, why are the questions about income in two different sources?
To different sources. Well, all of those would indicate that you're on a fixed income.
I told you. That's what I read. I knew he would be.
He's 13, so he's not.
13.
Well, someone without a disabling condition wouldn't be able to survive in their shed for 5 years, right? Or someone with a disabling condition is what I meant.
Necessarily.
Well, I mean, less easily, right? So this is the thing, right? We're still making decisions
Right.
based on the severity of service need that someone would have. I mean, this is someone who can survive.
But no,
And it's-
we had, remember the one, that,
Harold Tiger.
We're making impossible decisions here.
how did she was living in Cornfield?
Sure.
And this
Yeah,
does not have to
it's
be like
documented.
some tool that trumps it.
Mental health.
Like, the thing is you have to coordinate.
But no, she wasn't in those services.
If everybody knows
No.
who's homeless, then
No.
And she wasn't even hospitalized until the lady at the
Right, to the church.
took her to the hospital.
Yep.
Yeah.
And then we definitely found out she had health
Yeah.
issues because she died.
All right, so I'm just gonna make a,
Sam Rogers, you want to go ahead?
give an option to the folks out on the phones here. I think we're going to call it unless there's any other questions that we actually need to go over. Otherwise, I think that the rest of the conversation is stuff that we can have offline without actually going through the tool. But now that you know where this is, if you want to share it with any of your other staff who couldn't be here today, I'm going to put this video up eventually so you can watch the video as well. But if they have a HIMIS login, they can find Training Emergency Shelter and complete one of these prioritization tools on any of the clients or create a fake client in that program.
Right.
So you can let everybody know that. And so I'm going to just make sure that I get out of here, and I'm going to close down the webinar for all the folks out
The
there.
other webinar is available. I don't know if I don't remember if I've emailed everybody that there's a link to it out there.
All right. So folks on the webinar, thank you for calling in and for coming. And if you have any other questions, feel free to just email me or to take a look at the video and then email me. But thank you for being here. I'm going to shut it down, and we're going to, move along in our conversation the next time we all get together. So have a wonderful day, and I will talk to you soon. Thanks so much for coming.